Thank you, Nate. There's good news for peanut allergy sufferers. The FDA has approved a new drug that can treat the life-threatening condition. Palforzia is a controlled dose of peanut powder that is mixed with food and given to patients age 4 to 17 with a confirmed peanut allergy diagnosis. It works by increasing tolerance and thus reducing the risks of dangerous reactions to the allergen in peanuts, which patients must still avoid. All right, let's bring in an expert. Joining me now, Dr. Mark Siegel, who is a Fox News correspondent. Great to see you, Doc. Welcome back.
Hi, Bill. Good to be on with you.
Does this change the game a little bit? Because you and I have talked, there are companies out there that make a dust for kids that are still infants to get them to prevent this from happening from go.
That's not what this is. It does change the game, though, Bill. There's 1.6 million kids out there with peanut allergies. And you know what this does? This builds up very carefully a tolerance to peanuts so that if you have an allergy and you get an accidental exposure, you don't end up in the hospital. That's the goal. It gradually increases by trace amounts, the amount of peanut dust or powder you're exposed to in this drug. And it's under carefully controlled situations with an allergist monitoring it. You get to the point where if you were cross-contaminated or you had some food product that had peanut in it, you don't end up with anaphylaxis or with your life threatened and ending up in the hospital. That's the goal.
So bottom line, Doc, this drug could save PB&J as a staple of American school kids' lunch.
I don't think this drug will save PB&J as a staple of kids' lunches. You and I grew up with PB&J.
Right?
It's off the table now, but if somebody ate something that happened to have a little peanuts in it, they're not going to necessarily end up rushed to the hospital. That's the goal here. We got to get PB&J back on the plate. We're not there yet.
Thank you. Always good to talk to you.
Good to see you, Bill.